Hello and welcome back for episode 34 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Izami. In this week's episode, I sat down with Australian dentist based out of Sydney, Australia, Dr. Johan Choi, a fantastic young dentist, practice owner, and a top-notch clinician who's just producing some fantastic work. And you can check him out on Instagram at Dr. Johan Choi. I will tag him in the show notes. I just got back actually from Sydney, Australia this past weekend, attending a course run by Dr. Johan Choi and Dr. Bharat Agrawal called BxY Stratum, a fantastic posterior and anterior hands-on composite course covering layering techniques, rubber dam techniques, improving your work with sectional matrices, and just a lot of great tidbits that I was able to apply today at work. So it's quite nice to be around some young clinicians who are just doing amazing work and give you something to kind of aim for. It was my first CPD event in a little while, and I must admit I have come back a little bit rejuvenated and a little pumped up to get back at it and start to do some great work. Dr. David Attia was also there. These young guys, Australian crew, is just doing some fantastic stuff, and they're just doing really good work, and really leading the way for the next generation of up and coming Australian dentists. And for me, just to be there and rub elbows with these guys was a great experience. Get to ask them questions and pick their brains on certain topics and really learn from them. So I hope you guys enjoyed this episode with Dr. Johan Choi. We talk about a lot of topics, including practice ownership, clinical excellence, online or blended learning that he's done and Bharat's done in the UK at King's College. We talk about that course and the benefits and pros and cons of that. So I hope you guys enjoy this episode as much as I did. A lot of great talking points and a lot of good discussion. Dr. Johan Choi is quite insightful with his answers, and it makes for a great podcast. So I hope you guys enjoy it.
Hello and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Izami.
Hello, so I'm here today with Dr. Johan Choi, who's up-and-coming dentist in Sydney, Australia, doing fantastic work. If you're not familiar with him, I will link his Instagram page in the show notes. He's really heavy into restorative dentistry and does some really nice work, and I've been learning a lot from him, and I'm excited to have him here today on the podcast to kind of dive in a little bit and figure out what he's been through in his early part of his career, the journeys that he's been on, and the experiences and things he's learned so far. So Johan, thank you so much for coming on today. It's exciting to be here with you, and so I'm starting to connect with a lot of the Australian dentists, which is nice because I've moved over here now. A lot of great dentists doing great work, so it's nice to kind of get to interact with this little community and be involved. So if you don't mind, how I normally like to start these things off is just to go into a bit of an origin story by yourself, like maybe starting off from like dental school onwards a little bit, sort of what your career has been like so far. That'd be great, and we'll kind of take things from there.
Okay. Well, thank you for having me on the podcast, Omid. So a little bit about myself. I was worried for a moment there. I thought you wanted me to, sort of start from my immigration story back in 1991. But so in terms of dental school, I studied at the University of Queensland. It was 5-year undergraduate degree. So I graduated quite young, and I guess one of the things graduating quite young is you're very naive. You don't know what the world is like. You've always been a bookworm. During high school and university, just trying to get qualified.
Yeah.
I guess I start my story from there really because, although I've only been practicing as a dentist for 5 years, I guess I have had, a diverse range of experience that have shaped how, the type of practitioner and person I am today. So, starting at, coming out of dental school, never lived out of home before.
Yeah.
Got a job in Sydney. The allure of Bondi and the Sydney CBD, got to me.
Yeah.
I thought that I would be seeing, high-end cosmetic patients, full mouth rehabilitations from day one. Very naive.
Very ambitious.
Very ambitious, yes. And I guess, so I made the move down. So it was, a struggle in terms of, being independent and going about, being in this big group practice in Bondi and the Sydney CBD. And I guess that was the first step of of my journey, because I guess it really showed, that was the first experience in my life which showed me that, life doesn't always go to plan, and it's not always, favorable. So being in this group practice, I'm sure, you may understand that, being in a big group practice is, can often be competitive, a lot of egos. And, I didn't last, I thought it would be, I thought it would be this amazing opportunity, and it ended up being a very, enlightening experience in terms of, one, I found out that my personality wasn't suited to working for someone. Two, I determined that there's more to dentistry than just money. I wanted, clinical excellence. And I guess from that, it really showed me that I had to do it on my own. So, which moves me on to the next part. So being a salary dentist for the first year, I hadn't saved much. And, I had suddenly made a decision that I'm going to go into I'm going to have my own practice.
Nice.
Right. So still being naive, I approached all the banks, said, will anyone lend me $500,000 to buy a practice? And suddenly I ended up where I am now, Canada Bay Dental, in Breakfast Point in Sydney. It's really nice in a little retirement village type, suburb.
Yeah.
And I guess that was, number two naive decision, buying a practice when, one, I think, if you look at the Dunning-Kruger effect, I was still on this, the upward curve on the way up to Mount Stupid. And I thought I was invincible, top of the world, bought a practice, and you get in and you've got huge repayments to pay the bank. Clinically, you find out very quickly that you're not as good as you think you are. And suddenly you've got this huge uphill, battle of building a practice. So I guess, the last 4 years since then, since having the practice, have been, very geared around dentistry and, building a business and trying to learn as much as possible. And I think that has really encouraged me and pushed me to learn as much as I can. Because one of the things that I did find, in the early stages was, in dental school, you're competing amongst your peers, and, you may be one of the high achieving students. But once you graduate and once you're in the actual dental profession, you can no longer really compare yourself to just your immediate peers. Suddenly those colleagues who have 10, 15, 20 years experience, you're on the same level as them. So technically you should be able to offer a similar level of professionalism. When you look at it. And so for me, that was a huge amount of pressure, and also having that added pressure of having a practice was huge for me. But, I guess that's that, without, sort of going on for too long and boring all of your listeners.
That gives us a lot of talking points. That's really quite impressive. So how old, you're about 21, 22 when you finished up dental school then?
You're 22, yeah.
22. So I'm always envious of you guys who did the undergrad sort of model, because it just, your career is that much longer. And when you graduate, you don't have, so I was, I was 28 when I graduated. So it's a different life stressors when you're 28 versus 22. You gotta get married and buy a house and all this stuff. So all that stuff is more compounded onto you. But I think when you're still in your early part of your 20s, you still have that little bit of buffer where you can kind of be a bachelor and just focus on your profession or have some fun, whichever kind of path you decide to go on. So you worked for 1 year and then you bought a practice. Is that right?
Pretty much. So maybe a little bit over a year. So I worked 1 full year, and then I worked at the practice that I bought for 4 months before I decided, hey, I'm going to do this.
Yeah.
And I ended up buying the practice at the age of, I would have been 24 at that stage.
So what was that process like in terms of, handling staff? I'm sure they're all older than you, and all you're the baby in the group, but you're the boss all of a sudden. So how's that kind of transition like for you?
So I guess, part of being, I think although being naive, I didn't go into this, completely blind. I talked to, some of my mentors and some of my friends who had already, had practices before. And, one conscious decision that I had made was to get rid of the existing staff, because I knew that if I kept them on, that I wouldn't be able to stamp my foot down and do it my way, especially being, a young 23, 24-year-old, in this practice. And I knew the staff culture at this new practice as well, since I had worked there for a few months. And I knew that this was not a culture that I wanted to, spread through my business. So having said that, one of the, we got rid of the staff, we hired new staff, and, that's another lesson we've learned, hiring staff is so difficult.
Yeah.
I think that's a huge discussion that you could have as well. But essentially that's where we started, and essentially we started off, we bought a a practice grossing 300K in the first year. And this year we're on track for 1.5 within 4 years of ownership.
Amazing.
So it's I think we've been very lucky in our journey, that we've been able to maintain, we've tried to maintain a high quality of, clinical dentistry, whilst also trying to make sure it's financially viable. Because, I think people don't understand, the 1.5 million figure is, perhaps impressive after 4 years.
Yeah.
However, the next question you should ask me is, how much of that do you get to take home? Running a practice is not as glamorous as it would seem. Yeah, very expensive.
Yeah. So you're talking about, so you grew the practice from roughly $300,000, you said, to, on track for like 1.5 million, which is really impressive. So obviously there's a few angles I want to kind of approach here, and kind of one is clinical, one is kind of business. So let's talk about the business side of it first a little bit, if you don't mind. So like you were just saying, the overhead and the expenses of running a practice are quite steep. So what's that growth been like for you? Do you have associates working with you right now, or is it just you producing all the dentistry in the practice?
So I've actually got 2 practices now. I have a business partner as well.
Nice.
So that's the other thing that I didn't mention. Number 3 naive decision was deciding, hey, we can do this. Let's buy another practice.
Yeah.
So without getting into that too much, yes. So now we've got 2 or 3 associates. One of them is actually leaving us, so we need to find a new one actually. So any of the listeners of your podcast who want a job, please contact me.
Yeah, that'd be a great job. I'd fly over.
No, you'd be too good for us. So good. No, but based on that, we've grown from just being the 2 of us at the beginning to make it viable. My business partner, David, and I actually had to maintain part-time jobs elsewhere.
Yeah.
Because initially a very real thing most owners have to go through in the initial stages, where your practice income will not cover your overheads.
Yeah.
Yeah. Especially in the big cities like Sydney, Melbourne, and Brisbane, because, 300K, yes, if you get that in your pocket, that's a lot of money. However, when it comes to covering practice overhead, your practice overhead rent alone is probably 100K for the year.
Yeah.
Then staff wages are probably another, 50 to 100K a year, and then it just all adds up, and then there's nothing for you to take home. So, so that's been a huge learning, journey for us over the years.
That's good, but it seems like you guys are doing really well with it. So, in terms of clinical side of things, then I know it's often tricky when you want clinical excellence. So you want to spend the time with the patients, you want to spend the time doing the procedures properly. That kind of contradicts the business side of it, where you're trying to maybe be a quicker, more efficient, more income coming in. How did that balance kind of work out for you early on in the process?
I think for us, we were, being quiet initially was both a blessing, and a curse, because obviously, if, as you said, you want to see more patients, you want to see them more, you want to see them quickly, to increase your production. However, being quiet in the beginning really afforded us the time to just spend the time with our patients, to get to know them on a human level, and to, and to do good clinical dentistry, without any time limits. Now it's a bit of a different story, and I think it's really about keeping a balance. For me personally, I don't really, while taking a step back, I think clinical excellence in that Facebook standard, the social media standard, is not mandatory to do well on a daily basis.
Yeah.
Okay. So even when I have associates, the last thing that I stress on them is to get it up to a Facebook standard. I think when it comes to the nuts and bolts of real dentistry, it doesn't really matter if you've got that, that mesiobuccal fissure on your upper 6, perfectly crisp with tint in it. Yeah. What really matters is that the occlusion is right. It's sealed well. There's no pain, right? And the patient was comfortable during the experience. That's pretty much it. So as long, and that's the thing. I think for me as well, going through, my perception of dentistry has changed. And back to your question, really. Yes, it is. I think it comes down to having a balance. I still find that I've managed my practice in a way where I still charge quite high fees to make sure that I am adequately compensated for my time. Yeah. And I think most of my patients now, that come to see me now, come to me because they know that I will spend the time with them. And your patient base ultimately changes to reflect the type of practitioner you are. But you could easily make more money by, maybe perhaps lowering the standard, not in terms of true clinical standard, But on the scale of Facebook dentistry,
artistic dentistry,
still do a really, yeah, pretty much. And you could still do a really good job. Patient will be happy and you'll be a really good practitioner. I think that's what, your young listeners really have to understand, that, that on Facebook and social media and, Instagram as well, it's a lot of it is smoke and mirrors.
Yeah, for sure. I think that's something that I'm struggling. I mean, in my mind, I feel like I've been out for ages. I just feel like I've just been working for like a lifetime, but it's only been less than 2 years now that I've been working. And I'm always like struggling with that back and forth. Like when I see like great work on like Instagram and Facebook, and then I look at like my MOD and I'm like, why doesn't it look that good? Even though like I got a contact, the occlusion's good, patient's always never like a complaint, but deep down, like inside, I'm like, I feel like I'm always like lacking something. So that's a great point I just made for like new clinicians, that being functional and pain-free and comfortable for the patient is good dentistry. It's not like it's bad dentistry. Just because it's not like an artistic sort of thing that you're putting on Instagram or Facebook with the occlusal tints and like staining and stuff like that. A lot of patients would even look at that and be like, "Why is my tooth dirty? I thought it's like a new filling or something." So I think it's like,
have you actually ever had a patient say that to you?
I've heard it, but I haven't, not personally. I've just heard like anecdotes from like other people.
I actually have had it said to me before.
Yeah.
So, and it was probably 2 months ago.
Yeah.
I inserted a Lissy press onlay for a patient. It was fully documented, perfect rubber dam each step. The onlay prep was probably one of the best preps I'd done in my life. The ceramic came back. My ceramist had done an amazing job with the ceramic, and I thought, hey, this is amazing. Everything's going to plan. And I inserted it. Patient was happy. I'd insert a 2-week review just to check that everything was fine. Patient complains and goes, "Why did you make my tooth dirty?"
Yeah.
Right. So I think, which brings us on to that next point, which is really, I think, based on that functional versus artistic social media dentistry, patients don't care about that.
Yeah.
Patients really care about the function of it. And who are you trying to impress, really? Is your goal in life to impress other dentists?
Yeah.
Or, and I think that's a never ending path. I think that's a path set up for insecurity, anxiety, and, unhappiness. Yeah. But I think we should, our number one focus should be, yes, let's make our patients happy. Let's make sure that we can increase the longevity of the treatment for our patients the most. And then if you can also do some artistic stuff to give you some professional satisfaction on the side without taking too much out of your normal clinical life, then I think that's beneficial.
That's great advice.
And I think, and I think that's why Bharat and I think he was on your podcast last week.
Yeah.
Bharat and I really want to, that's why we've said, hey, let's, we may be, a bit more inexperienced, but let's go and run this course, because we're running this course, and you'll be coming to the December one, I've heard.
That was a nice offer. I'm excited to come see and learn from you guys, actually. So what's the course called? I think it's going to be a posterior anterior hands-on composite course. Is that right?
Yes. So it's Bharat came up with the name Stratum in terms of, stratification. And I know that may sound fancy and difficult, but what we really wanted is, and I think the way we will differentiate ourselves is that these are techniques that we are using in normal private practice.
Yeah.
Techniques that aren't going to take 4 to 5 hours of your time for a single restoration. These are techniques, it might take you a little bit longer, but once you become familiar with them, they are techniques you can use day in, day out.
Yeah.
And simple recipes where you're not spending an hour figuring out the shade. It's from our experiences with the materials we've used. We'll be talking about, hey, within this color range, if you use these combination of shades without even looking at the tooth, you'll be fine. It will camouflage in and you will look fine. And I think there's just little tips there and there. We're not there to teach you the world's most artistic style Italiano, filling.
Yeah.
We're there to teach you, hey, it's going to look pretty good. It's going to function really well. And you'll both be professionally satisfied, and your patients will be left with a really good product as well. So, we're looking forward to having you there.
That's excellent. I'm excited. I think going forward, I see this as more of the model for like CPD courses where, you don't necessarily need to have like the foremost world expert coming to teach you like how to do a composite. I think it's more practical, if anything, just to have, someone with a little bit more experience who's doing it day in, day out, who can relate to kind of the time pressures or material like resources available, and just teach you like a practical way of kind of doing things. I think I'm excited. I think I'm going to learn a lot, and I think that's what we're trying to kind of do as well with like our study club that we're running, some of the lectures that we're doing, trying to create a more small like collegial environment where people can come and share advice and techniques and kind of learn from each other. So another thing I kind of, when I speak to people like you, I kind of get motivated and inspired because, for such a short span of a career so far, you've accomplished so much, clinically and business wise. Tell me, like, kind of shifting to more to the clinical side of things. Obviously, you mentioned you started off and you're in a bit of a group practice. So I assume did you have some mentorship in that year and a bit that you were working that group practice, or were you kind of just thrown into the deep end and kind of had to fend for yourself?
Yeah. Look, I think I've never really had a true mentor in my career, which I regret. I think partially, perhaps that came down to circumstances, throughout my career, but also probably came down to me not being proactive enough to find, a mentor who would mentor me. I think that also came down to the fact that I as a young grad, and I think, this may be true for a lot of young grads, that we aren't truly prepared to listen.
Yeah, that's tough.
A lot of us, I think we know it all, and it's only from failure or perhaps, maybe not failure, but perhaps unfavorable experience where you learn that, hey, maybe I am, maybe I'm not as good as I am.
Yeah.
That I think I am. And, perhaps I should, really start listening from other people. So, to answer your question, no, I didn't really have a mentor, but I was very fortunate to make a very close friend who had been out for a couple more years than I was at the time in my first job. We're still very good friends today. We're both not in that practice anymore, but we still try and catch up. But he was probably, I said that I never really had a proper mentor, but he was probably the closest thing to a mentor that I had at the time.
Yeah.
Okay. And, he would teach me little tricks and tips that he picked up along his journey, because he didn't really have a mentor either. So it was a very similar model where he probably had got tips from people who were a bit more experienced than he was. Yeah. And then he passed those tips on to me. So it was, how to get your rubber dam tucked in a certain way, or how to layer your composite a little way. And then from those things, I did a bit of experimentation and figured out the best way for me. Mm-hmm. So I think, that also then brings us back to what I really want to do. And, as you said before, I think the model will change where, you don't need the world expert coming in, because what a lot of these world experts show you is not possible in daily clinical practice. Yeah. I don't think people understand what actually goes in to making one of these cases. Recently I had a case published with GC and Henry Schein. And to put into perspective, because, look, I don't want people to be under any illusions. That case probably took twice as long because I knew it was going to get documented. Yeah. It took me twice as long to do it, right? I probably ended up taking 200 photos for a single central anterior tooth.
Yeah.
Okay. And at the end, in the publication, only 9 photos get selected.
Yeah.
Does that make sense?
I appreciate the honesty, because I think that's something that's lost on a lot of people, right? We'll scroll through Instagram and like, how is every case everyone does perfect, like all the time? And you don't realize, like you said, you take hundreds of photos and like the lighting is just perfect on the one, and you just pick that one and you post it. So I think it's really nice to hear like the background of what goes into these little cases that get publicated. So taking photography is great, because I think one is obviously you can document your work and you can show and share to people to learn. But also it's nice if you're going to be critical of your own work. If you take photos and you can, because like so many times I'll do something like I'll do like an onlay or like a filling, and then I take some pictures. I come home and then I put it on my iPad and like blow it up and zoom in, and it looks like terrible. I'm like, man, like I thought it was like so good, and then you come home and you zoom in, and you're like, man, that's not great work. So it's nice to have that feedback for yourself and to be competitive with yourself. Yeah. I think that's like the more healthier way than to, like you said earlier, trying to compete with other people and trying to like beat other people. I think that's like the kind of the better approach.
Yeah, you make a really good point, because I think a lot of the times when people get into photography, I think they get into it for the wrong reasons. A lot of people get into it for the reason of, hey, I think I'm good, so I'm going to start taking photos so I can start showing off to my peers. Mm-hmm. And I think that's, and I think if you go into it with that mentality, you'll soon find out that there is someone better than you. Yeah. So and I think it's very disheartening to find out that, it's that you're not as good as you thought you were. And, so I think, if you are planning on taking photography of your work, you need to do it for the right reasons. I think it is somewhat mandatory now, in this day and age, to take photographs, both from a documentation and medical legal standpoint, but also from the, standpoint of just, as you said before, it's the perfect way to improve. When new grads come up to me and say, hey, what's the one tip that you can tell me on how to improve?
Yeah.
The first tip is buy a camera. Don't buy a car. Don't use your first paycheck to go and buy a car. Buy a DSLR camera. It doesn't have to be expensive. Just buy a camera, learn how to use it. If you have any questions, come ask me. But start documenting your work. And it's not because you want to document all your fancy work. It's about, knowing how, did I put that, sectional matrix in properly?
Mm-hmm.
And looking back on your steps, if you get a subpar result at the end, looking through your steps will tell you where you went wrong and how you can improve for the next case. So I think it's just about trying to do better every day and being the best that you can.
Mm-hmm. That's great. So in terms of continuing on with the clinical sort of pathway a little bit, tell me a little bit about when you feel like in your, you've been out for 5 years now, you've been working. When was there like that biggest growth that you experienced? Was it like from year 1 to year 2? Was it the first 6 months? When did you feel like, okay, I've started to like be on a growth trajectory now. I'm like getting new techniques. I'm executing it nicely, and I'm happy with the results. So
your question is, when did I start feeling as
when did you feel like
what I was doing?
You're clinically like improving a lot? Like when did you notice like a noticeable difference?
Well, I think it's that question. I think can be, I think it depends on your perspective, right? I think it depends on whether you're answering that question in hindsight or in terms of foresight. Yeah. Because when you look in foresight, you always think that I still have room to grow and I still have so much room to grow. So my biggest growth is going to come later on.
Yeah.
Now, having had a couple of years behind me, and if I look at that question in hindsight, I think every year there has been massive growth because you may not realize it at the time. And, I think a lot of people trying to measure their growth in terms of, in terms of, hey, have I learned how to place implants this year? Have I learned how to do, cosmetic dentistry in terms of indirect restorations? So I think we categorize our learning a lot. Yeah. But my massive growth, I feel like, for the first 2 years of my career, all I focused on was direct restorations and being a good, doing the bread and butter well. Okay. So, people, from my perspective, I felt as though I had massive growth in those first 2 years because going from someone, where I thought I was doing good composite restorations back in uni, but I quickly found out that they were atrocious. Yeah. And, going from someone who could do a crap filling to an acceptable filling by year 2, I thought that was a huge level of growth. Now, if you look at that in the perspective of, hey, I didn't learn how to do ortho, I didn't learn how to place implants, the growth may have not been that significant. But for me personally, I felt, hey, I know how to do the bread and butter well. Yeah. I have the basics down pat. I think I'm ready to pursue some more advanced learning. And that's when I started my master's degree in my 3rd year, because I felt as though I wanted some sort of structured learning to really upgrade my dentistry.
That's great. I wanted to ask you about that because I know obviously you're doing that program. Brad's also done a similar thing through the UK as well. What was that decision process like for you in terms of, first of all, like to go through that, like the sort of the online distance learning way, which I think is great. I think it's way more practical than maybe the traditional specializing, especially nowadays for, a lot of the listeners who are, based in North America with the crazy tuition expenses and everything. Like to go through dental school and be like a couple $100,000 in debt. And then to go back to like, get a prosthodontist residency or perio residency. So you're not working one and then you're incurring more debt to kind of go through like the whole specialty training. Obviously the masters that you guys are going through it's not cheap, but I think it enables you to still work, which is nice. First of all, just go through like what that decision-making process was in terms of what sort of program. And then just share your experiences, if you don't mind, of what it's been like. Because it's something that after meeting you two guys, it's kind of motivated me, and I've been kind of reading up on them a little bit because I think it's been quite useful for you guys and it's helped your growth a lot. And I think I always try and find successful people and try and just like emulate what they're doing. So if you don't mind, for some people who may not be familiar with these sort of Masters of Science programs, just share your experiences and your decision-making process. That would be great.
So I guess it came down to let's start off from the beginning where after my first 2 years I'd still done a lot of CPD during those 2 years. Yeah. And what you quickly find out the more CPD you do is that most lecturers have an agenda.
Yeah.
Right. Some courses are not very good. despite what reviews they may get or, how they are advertised. And so my decision-making process, really came down to, hey, I want to upgrade my clinical dentistry and take it to the next level. However, I want to do that in a structured environment. And I think the safeguard for me at the time was that, hey, if it's done through a reputable institution, then it'll have to be at least to a somewhat good standard that will be structured. And yes, it may be very academic, but at least it'll be structured and it'll be evidence-based and proper accepted dentistry. So I guess that was the reason for me to do it. In terms of your question, when it came to doing a full-time specialty residency versus my MClinDent program through King's, time-wise, probably a specialty program would take you less time, because my MClinDent program is 4 years versus a pros program, as far as I'm aware, is 3 years.
That's right.
Yes. I guess, the contact hours are completely different. So, kudos to those, pros residents out there slaving away in the labs and the clinics. But for me, I guess, if I had the opportunity, I would have loved to go off and specialize, all the way. But for me, at that time, I already had 2 practices.
Yeah.
So I was not in a position to, to go off and specialize. I needed something that would afford me flexibility where I could study in my own time, and, get to that level that I wanted to get to. I think, as you said, these distance learning, or as Kings like to call it, they call it blended learning, because it's not completely just distance.
Yeah.
I think it's a perfect mix, because I think that in this age of, where everyone is so connectable, where we can have this conversation so easily, online, it's you don't need someone to hold your hand 24/7.
Yeah.
If you have recommended reading and you have your coursework, then you can easily get through that in your own time. But yes, you do need contact time in the clinics, in the sim labs, going over procedures, so you can try them out on phantom heads first before you go and take it out to your patients. And the other thing as well is that, these courses, because they ask you, you're required to, submit documented cases. You're always documenting. And I think that's where the next, the next source of growth really comes from. I think the other thing though is, the silver lining, the caveat to all of what I've said is this. I think you need to really go into it with the right mentality, because I think regardless of whether it's a distance learning or a actual specialty residency, at universities, I think the problem is that, it's very different to undergrad in terms of they're not there to spoon feed you anymore.
Yeah.
You've got your mandatory coursework, but then you've got your recommended reading, and then you've got your extra reading. And, some of the advice that I had gotten before I got into the course from previous graduates, and having, now in my, being 3/4 of the way through my program, the thing you quickly realize is that you only get out from this degree what you put in.
Yeah.
So if you're going to do it and you don't have much time, you don't have enough time to invest into, the actual study, you're not going to get much out of it. You'll be a slightly better dentist, but, no one's going to say, hey, you should read more of this or read more of that.
Yeah.
It's pretty easy to pass. You just need to know the basics to pass, but to be, it's not going to make you the world's most amazing dentist.
That makes sense. Yeah.
And I think that's what some people struggle. That's what a lot of people struggle with. So, for example, in my degree, when I first started this, we had 30 people from around the world do it. Now in my 3rd year, going on to my 4th year, I think we have 15. So 50% dropped out.
Some attrition there. I think that's tough. I think a lot of people maybe started off with like good intentions, and then like life gets in the way, and not having those like set contact hours. I think some personalities may not cope well with that. And I think that's not like something that I might be a struggle for me to like be okay, from like Monday, Wednesday, Thursday nights, I'm going to spend 3 hours like each night kind of doing it, because I need to be a little bit more regimented and have some like accountability to like actually follow through with it. Unless like I post about it, and like I have to be like, from this time to this time, I'm going to study, and then like I have to kind of follow through with it, which is sad, but I think that's the way it is. So you're doing Masters of Clinical Dentistry in, is it fixed and removable prosthodontics? Is that the
yes,
subject?
That's correct. Yeah.
So what made you pick that over like some of the other like aesthetic dentistry or like other like subjects that they provide as well?
I think I look at the modules, the learning modules, and I think, I also then looked at my demographic. I think there's no point going off and doing CPD or or further postgraduate training in an area which you're not going to utilize in your practice.
That's very smart.
So I looked at my demographic, and I looked at my demographic, and most of my patients are mid to later in life. Mm-hmm. So from my perspective, those patients probably aren't as interested in aesthetics, although I think aesthetics is something, that we should all be aiming for. But most of these people are looking at long-term dentistry where, they may need, rehabilitation or, maintenance of teeth that have been, mutilated through life or, been damaged through life.
Yeah.
And so I think that's what, really prosthodontics covers. And, this program is not going to help you treat absolutely every single case that walks through your door. But, I just wanted something that was structured that would really help me approach these patients in a very evidence-based way, in a way that, and in where I could feel confident that I was really truly doing a service to my patients.
That's great. And what's been so obviously you're doing the program right now, so you're kind of working your way through it. Has it been applicable directly right away? From when you started the course, are you able to apply things that you're learning in the course in your day-to-day practice?
Yeah. So I think so basically a lot of the stuff that you'll learn by yourself over, the learning modules and things like that, a lot of that is, it's knowing the reason behind why you might do something. In terms of the techniques that you'll come and actually employ in your practice, you'll need to wait for your contact time at Lundeck in London. Mm-hmm. So for example, that, I guess if I can remember back, my first contact residency over at King's, you go over, the Dahl effect. So that's very useful for treating localized anterior wear. Yeah. You talk about, a lot of us already probably know how to use an articulator and, assess occlusion well, but one of the topics is, knowing how to mount your cast on articulator accurately, going through the occlusal analysis and knowing which patients you might have to deprogram or, whether this patient might need a reorganized or a conformed, occlusal scheme. So I think, as soon as you start learning those things throughout your course, obviously, I think, you need to become confident with what you've learned, but, there are many techniques there that you can actually employ, in your practice.
So how often in the whole program do you have to fly over and have some direct contact hours?
So with the King's program, you've probably got 2 weeks. You've got a 2-week residency every year. So you've essentially got about around 14 days nonstop at Lundeck going through, and long days. We're talking about 8 to 6 most days. Yeah. Just going through. You've got some lectures, but you're in the sim clinic. You'll be prepping teeth, going through different prep designs, rationale for prep design, and that sort of thing. Mm-hmm. Those 2 weeks, but I find that those 2 weeks are all that you really need, because you'll come back and then you'll apply those things on your patients. Yeah, no, it's great. Sounds very, sounds appealing. So overall, would you recommend for people to look into these kind of training options? What's your overall verdict on it? Oh, very hard. Look, I think, based on what I've said, look at what what type of person you are. As I've said, you need to, be driven. You need to be, you need to be able to independently motivate yourself. And I guess it depends on, you be prepared to be disappointed on how literature-based and evidence-based it is. Because there's going to be a lot of study, and at times you may feel as though a lot of what you're learning is irrelevant. Mm-hmm. If all you're interested in is, let me back that up by saying, if all you're interested in is learning clinical hands-on techniques, don't do it. Yeah. Because just go off and do, the Smithson Mac masterclass and, anterior, posterior, indirect restorations, or do a hands-on course elsewhere, and you'll probably pick up the same hands-on tips. It's just that you probably may not be as a well-rounded clinician in terms of understanding the literature behind why you do a certain thing. Yeah. Mm-hmm. That makes sense. I think that's good tip. Yeah. You need a lot of reflection. I think I'm still in that same boat too. The way the model of dentistry is going, if you're not going to be owning your own practice, like you said, and being able to practice the way you want to practice, if you're an associate elsewhere and you're kind of doing 30-minute exams and clean, the type of dentistry you're doing needs to, like you said, you have to be seeing your demographics and the type of practice that you're working in, and then decide if adding this knowledge is going to change the way you're able to practice within that setting. So I think being your own boss and having your own practice is definitely
a necessary step if you want to do things like the right way and your way, I think. So I think you have to kind of weigh up and see which one you want to get to first, like learn the dentistry first and then open a practice, or open a practice and then like grow into that practice, like by like becoming a clinician. So, so tell me a little bit about, obviously you touched on a little bit about the course that you guys are running. So we've talked about the past a little bit. Let's talk about the future for a few minutes before we kind of wrap up. So what's like your sort of like short-term plans for the next like 5 years, like clinically, business-wise within dentistry?
Look, I think if I can just keep doing what I'm doing at a similar level of growth, I will be very happy, both clinically and business-wise. Look, end of the day, I think the hardest thing is to at least maintain what you're doing. So, so for me, it'll just be, going into work every day, focusing on, being the best, clinician and businessman that I can be. I think probably the new thing that I would like to concentrate on over the next couple of years is probably really focusing on maybe seeing if I can get some cases published, perhaps in some journals as well. Really just trying to elevate that clinical dentistry, and also, working with my good friends, to really share what we've learned. I personally have probably spent over $200,000 on professional education in the past, 4 to 5 years. Mm-hmm. So I've spent a lot. I've done some great CPD. I've done some, really bad CPD. And I think it's, as you can, hopefully, you've really felt from this podcast today that I'm a no BS type of person. I say it how it is. The backlash I'll deal with later, but I'll just say it how it is. So I really want to give people, especially young graduates, and that's what that's what I'm really passionate about. I really want to set up, as you said, with your community as well. One thing that I've always felt is, I was a bit disappointed with the culture within our profession.
Yeah, for sure.
And I think it's very difficult for us to change the culture amongst dentists who have been out for a long time. But I think we can really change the culture for people coming after us. Really have a collegial feel. Where perhaps we're not. I think we shouldn't be competitive with each other. There is enough work out there for all of us, and really have a community where we're helping each other. To grow and be a really united front. Yeah. So I guess having said that, I think in order for me to contribute to that mission, to somewhat of a degree, I think it's really for us, it's running a simple course. Trying to build a community of like-minded individuals where we can really openly share and tell them how it really is. None of this, none of the stuff where I can do this in 30 minutes and have this perfect restoration. But, this is what went into getting, documenting this case. But you may be able to do this to achieve a similar level of work in an actual reasonable amount of time in clinical practice. And look, who knows what the future will tell us? I wish I had a crystal ball to say, hey, this is what I'll be doing in a couple of years. But really, I think it's going to come down to really just having that mentality of sharing, trying to build that community. If anyone ever wants to ask me questions on Instagram about cases or what they should be doing, I'm more than happy to help. Or if they want to email me or contact me, I'm more than happy to help anytime. So I think it's we can both you and I think we're in a position to really help people and to really grow this community. Don't you think?
That's great. I love that. I think my wife's a physician, so what I sort of envy about their how their workplace is the environment that they're in. They're always around other doctors. They're always like there's a good banter. There's the community feel. They have each other's backs. Conversely, with dentistry, I think, one is like most of us work in isolation. So we're in a practice by ourselves. So you don't really have anyone to kind of bounce ideas off. And then even then once we connect, there's so much like competition, within Australia, like the groups like DPR and stuff, there's always a lot of banter on there and it's not always positive. So I feel like people share a case in goodwill, trying to get some feedback. And then like, the community is not great. The way that people interact is necessarily, like you said, the older generations maybe not great. So I think if our generation, what we can do, maybe our mark on dentistry will be changing that mindset, into a growth mindset where everyone's kind of more supportive, and people feel like they're part of the community instead of just like competing with the guy down the road. I think that'd be a great thing if we can actually, make that happen and make that change. I think it'll change the profession for the better.
Yeah, I think it's about, as you said, I think we have to be innovative. There are, I think, last census data showed 22 to 24 million people in Australia. Yeah. And I think there are more than enough people in Australia to support the number of dentists they are.
Mm-hmm.
But I think rather than focusing on what the guy beside you is doing and how to steal his work, I think it's really going to come down to being innovative, improving access to dental care for people. As I said, not everyone has to be doing, social media dentistry. There are all facets of dentistry, and you've got to find out, you've got to really find out what type of dentistry suits you. And, it's just about being innovative and delivering that care in new ways. So I think, it's exciting times ahead. I think, as young people, we have to be imaginative. We've got to, and I think by doing that, we can really change the culture. And hopefully, I'm really excited to, see what's in future for our profession in 10, 20 years time. So
yeah, for sure. I think it's exciting. There's so many changes, like you said, like technology is improving. We can get more efficient maybe with things as the incorporation of technology into like the workplace and workflow kind of improves a little bit as well. And I think one of the bigger things I think is I always tell patients is, when you have the patients who are like maybe 70 and they come in and when they're like, oh, when I was a kid, like the dentist had their knee on my chest and they're like taking teeth out without like anesthesia and stuff. I think as dentistry is improving, patient experience is improving. So I think like kind of the generations going forward, that kind of anxiety and fear might be subsiding a little bit too, which is nice. Because I think like if people are happy to come see you, it affects your mood. And I think it's like one of the things that maybe dislike about dentistry is as soon as someone sits down, they're like, oh, I hate the dentist. I hate being here. And I'm like, all right, cool. Like, let me just do my work now. And like, so I think if that patient side of things improves a little bit too, I think we'll be happier in the workplace. And I think that'll improve things. Awesome, man. Thank you so much. So what I would like to do usually to wrap up is just go through a quick rapid fire just to lighten things up and to wrap up that way. So what's your favorite pizza topping?
Pizza topping. Oh man, I'm a basic guy. Just a bit of mozzarella and tomato base, and I'm sweet, mate.
Awesome. What's your favorite tooth to work on?
Tooth to work on? Tooth to work on upper six.
Upper six? How come?
Yeah.
You like the anatomy of it, or?
I like the anatomy of it. It's a little bit more complex. I think if when I'm doing a composite restoration on upper six, and you can really make it look nice, it's a bit fulfilling because it was a bit more challenging. So and the access is a little bit challenging as well. But yeah, the upper six is my favorite too.
Okay, so if you had one procedure that you could do for the rest of your career and only that one procedure, what would it be?
Crowns on upper six. Onlay on upper six.
Onlays on upper six. What's one procedure that makes you question your career choice in dentistry when you're doing it?
Endodontics.
No one likes endo. I don't mind it, but I had 2 file separations in 1 week, so I'm a bit down on endo right now. I'd never had one, and then 2 in 1 week. So not a great week.
If any of your listeners love endo, please contact me. I'm looking for an associate who wants to do endo.
I'll come do it if you don't mind the occasional file separation. So if you weren't a dentist, what would you be doing?
If I wasn't a dentist, look, I feel as though perhaps I'd be a teacher. Hey, I think, based on what, anyway, these are quick 5 questions, so I won't go into too much. Yeah. But yeah, it's just that sharing that knowledge. Yeah.
Being a teacher. And what's your favorite musical band or artist?
Oh, that's a hard one. Hey, I don't know. It always changes, mate. Yeah. I'm very impressionable when it comes to music. I'm one of the sheep in the crowd.
Yeah. All right.
Yeah, I follow whatever's trendy.
Yeah, perfect. Awesome. Thanks a lot for coming on. It's been a pleasure. Hey, thank you for listening to this week's episode. I hope you got as much value from it as I did. And as always, please reach out to me at Noobie Dentist on Instagram with any feedback or questions. I do love to hear from you guys. And if you're a fan of the show and have some, positive things to say, please rate us on iTunes and leave a review behind. And that really helps the podcast grow. So thank you.